Hi, everyone. My name is Brittany, and first off, I just want to say thank you for letting me crash your lecture and talk to you a little bit about my experience as a patient with PTSD who also experiences anesthesia-related emergence delirium. I was diagnosed with Crohn's disease at the age of 11, and so I had a lot of experiences with anesthesia and coming into the medical system as a patient with a chronic illness. And so from the ages of 11 until I was 15, my experiences with anesthesia were fairly typical. Because I was a child, I would get a little emotional sometimes, but I never woke up combative. I never woke up aggressive. I know emergence delirium really wasn't even a term back then that people would have used, but I really did not have those behaviors. And that all changed when I turned 15. And when I was 15, my world was turned upside down. I was a freshman in high school, and at the age of 15, I became one of the first children in the country to survive a mass school shooting. And at that time, there really weren't a lot of policies in place. There were not any best practices on how to work with children like me who had survived a mass shooting because things like this didn't happen. This was actually 2 years before the shooting at Columbine High School happened. And so when that shooting happened in December of 1997, my next experience with anesthesia would have been the following summer, so about 5 to 6 months later, when I had a colonoscopy. And it was in that colonoscopy that I believe that was my first episode of emergence delirium. I remember being in the procedure room and laughing and cutting up and joking with my GI. And then the moment they gave me Versed, I instantly started having a panic attack. And as the anesthesia started to take effect more, I vividly remember having a hallucination that the shooter was at the bedside and that he had a gun pointed at my head and was going to execute me in a similar way that he had shot and killed my friends who were all around me in the shooting. And I'd actually lost one of my really close friends who was shot and next to me in the shooting as well. And if you can imagine going under anesthesia, thinking that your life is in danger, you will also wake up that way. And that's what happened. I woke up very combative, very aggressive. I don't remember these behaviors. It's what was told to me. I pulled my IV out. I was kicking and screaming and begging for help, telling people to get down. I think I even maybe hit a couple of nurses. And as that emergence delirium kind of wore off and I started coming back into my body and recognizing where I was, I remember people being looking very disheveled, like they had kind of been through a tornado. People were all around my bedside, they were grabbing me. And what I remember is they were all very angry at me. The anesthesiologist scolded me and told me that I was too old to act this way, that this was ridiculous. Some of the nurses had refused to care for me and said that they wouldn't care for me because of my behaviors and they were going to have to find someone else. My mom was frustrated with me. Even my GI, who I had a very close relationship with, was really concerned and was like, I thought you trusted me. Like, why are you acting this way? Because I had not acted this way under his care up until this had happened. And I will never forget laying in that bed and thinking, because I was struggling a lot with survivor's guilt and that I hadn't been able to save my friends who were shot and killed next to me. And I will never remember or never forget laying in that bed and thinking, I'm not just a bad friend now, I'm a bad patient. And so that shame carried on with me for years because I was having a chronic illness and having Crohn's disease. I entered the medical system multiple times, going on into adulthood, even until recently. I'm not just somebody who has one or two anesthesia experiences. This is an ongoing thing for me. And my experiences with emergence delirium continued to get worse. They did not get better. I have an amazing GI now. This is the same GI who took care of me from the time I was 19 when I established care with her in college. And she has been fantastic. She's like a second mother to me. But when I have needed to seek care outside of her expertise and have had to see colorectal surgeons and been involved with anesthesia providers, it has been very traumatizing because my experiences have continued to be the same or if not worse. I have overheard nurses laughing at me at the nurses station for the things that I said when I was waking up. I've been mocked. I've been laughed at. When I recognized the connection between Versed and emergence delirium and started trying to self-advocate and ask for alternative medication strategies that didn't involve Versed, I was accused of being a drug seeker and faking. And And I will say that I had many anesthesia providers who were very kind to me, but they were very unwilling to practice outside of using propofol and Versed. It was kind of like, this is what we do, this is how it's going to go. And it really felt like they were saying it was up to me to control this behavior. And I couldn't control it. And I can remember so vividly, so many times in the last 2 years going under surgeries, going under for surgery, and just trying to will myself into thinking that maybe if I tell myself enough to not do this, it won't happen, and going to sleep and thinking, please be normal, please be normal, but knowing that I couldn't control the emergence delirium any more than I could control whether or not I had to sneeze. And surely enough, I would wake up each time combative and aggressive and really just being treated poorly by the staff who didn't understand emergence delirium and really, in a lot of ways, blamed me for the behavior. Eventually, in 2023, when things got really bad and I was developing abscesses and fistulas and requiring surgeries in really short periods of time, I think I had five surgeries in a period of 14 months. I eventually got to a point where I told my GI, I was like, I don't even know if the next time I get an abscess and fistula, if I'm even going to tell you, because I can't see you for that. I have to see a surgeon, and the way I'm being treated is so bad that I'm like considering delaying medical care because I am almost ready to risk the consequences of delaying medical care than to go back and have that type of surgery experience again. I just didn't know where else to turn because it felt hopeless. I had seen multiple providers, multiple surgeons, multiple everything, and still was having the same experience everywhere. The only person I trusted was my GI, but due to the complexity of my Crohn's, I was needing surgical interventions, which she could not do as a GI. And so I was hopeless and I wasn't sure that I was even going to survive it at that point. But I am happy to tell you that after 27 years, I have finally found a new surgeon with a new anesthesia team. They're in an amazing academic medical facility that's just a couple of hours from where I live. And I had surgery last week. I had a fistulotomy, and this team was fantastic. I went in, I tried to advocate for myself, and I didn't even have to advocate for myself because the surgical team did that for me. The anesthesiologist, the CRNA, they came in and met me. They talked to me before going into the OR, which was great because when I get transferred to the OR, they take my glasses and I can't see. So it was really nice to not just meet the anesthesiologist and see him, because sometimes you get to the OR and you realize the anesthesiologist isn't there, it's the CRNA, but I can't physically see them. So it was fantastic that they came in and met me and talked to me. They explained everything to me when I asked for an alternative anesthesia plan and explained emergence delirium and my reactions to Versed. They had no problem. I wasn't labeled as a drug seeker. There was just absolutely no hesitation in them to work an anesthesia plan that was tailored to my needs. It wasn't just this cookie cutter approach of this is how we always do it. They actually tailored an anesthesia plan to me. And in 27 years, I've never had that happen. And so I just can't tell you how important it is to tailor your anesthesia to your patient, because for so many years, 27 years, I think people tried to just shame me out of emergent delirium behaviors, and it didn't work. What they did was shame me out of ever coming back into the medical system and feeling like I wasn't going to be safe, because at the end of the day, it wasn't just a safety risk for me, it was a safety risk for the staff who were taking care of me. And when I came to this new hospital and this new treatment team, they instantly met me where I was at. And so, what I will tell you is that with you all working in a VA hospital, it's going to be just as common for you to experience patients with emergence delirium in a civilian hospital as it is in a VA hospital. And I think it's probably also true to say that most patients are not going to self-disclose that they have PTSD. So, it's really important that you pre-plan how you're going to establish and build rapport for patients, because most patients aren't going to self-disclose. And I can assure you that there are hundreds, if not thousands, of patients out there who are just like me in the medical system, and many of them can't advocate for themselves or they've already given up. But you are in a position as a CRNA and you have the ability to be the reason why a patient like me seeks out medical care again. I know it sounds cliche, but I can tell you from experience that the care I received from this new surgeon, the new nurse anesthetist, the new anesthesiologist, and everyone in the OR, the nursing staff, pre-op, PACU, recovery, all of that entire team, their treatment of me is why for the first time in 27 years I feel safe receiving care. And until last week, I really thought my GI was the only person I could trust. And now I know that not only can I trust her, but I now have an entire surgical team that is going to help me in the progression of my disease if I need surgery again, which I know I probably will. But this time I know that I'm going to be safe. And I have a whole team who is standing right behind me, who's going to work to ensure that they're not just meeting my physical needs, they are meeting the emotional needs. Because I will tell you, you will never establish rapport or trust with your patients unless you understand that their emotional and mental health needs are every bit as important as their physical needs. So thank you all so much for including emergence delirium and the education of that in your academic studies. I really think if I had been a patient who another provider had had this education, I would have been identified and treated much differently, much earlier on in my experience. So this is extremely important to me. It's something I'm really passionate about, and I can't thank you enough for taking the time to listen to my story, but for including this as part of your education. So thank you for what you do. And if you ever have any questions, I'm more than happy to talk to anybody. Regina has my contact information, so please feel free to reach out if there's ever any way I can be of help. So thank you for your time, and bye.